If your quest for longevity feels overwhelming, here's some good news. It starts with one simple daily habit. MitoPure gummies from Timeline. They're the first ever longevity gummies that ignite mitophagy, your body's natural anti-aging pathway. MitoPure is a clinically validated solution backed by over 15 years of research. MitoPure gummies utilize a powerful compound that redefines what's possible for your longevity. MitoPure produces the first ever urolithin A gummies that support your cellular energy so you feel strong, clear, and vibrant. Boost your cellular energy and enhance muscle strength and endurance, all without changing your diet or exercise routine. As someone who loves to stay active, I've noticed a significant boost in my workouts since I started using it. I feel stronger and more energized, and my recovery time has improved dramatically. Better recovery starts at the cellular level. For more information and to order, just go to timeline.com/Hoffman. Use coupon code Hoffman at checkout for 20% off. That's timeline.com/Hoffman for 20% off MitoPure gummies with code Hoffman.
Welcome to Intelligent Medicine, America's foremost program on health, medicine, and nutrition, featuring the latest on both conventional and alternative therapies. Now, here's Dr. Ronald Hoffman.
Welcome back to another hour of the weekend edition of Intelligent Medicine. Intelligent Medicine, we talk the best of high-tech, the best of natural, putting those together for you. We call Intelligent Medicine. You can be part of that conversation by calling 877-726-8255 with a question or comment. And let's start this hour with one of your questions. What's going on?
Hello. I have ear ringing in my left ear, and I've had it for 10 years now. I've been to a few doctors way back, and they said there was nothing that could be done, that it comes from your brain, not your ear. And I was just wondering if they have found a cure for it, if you would know of it. Thank you.
Okay, so this is a big problem, and it afflicts a very large number of Americans, sometimes referred to as tinnitus or tinnitus. I think tinnitus, the more commonly accepted pronunciation. And, you know, it may be ringing or it may be whooshing, sometimes accompanied by some degree of hearing loss, sometimes not. And your doctor is correct, because mostly it's not in the ear. And, you know, the different parts of the ear, there's the outer ear, there's the middle ear, there's the inner ear. And then there's the auditory centers in the brain where the information gathered in the ear is transferred via the auditory nerve to the auditory center of the brain. You know, just like there's a visual cortex in the brain, there's an auditory cortex, which is responsible for hearing and interpreting sound. And the new thing about tinnitus is it's a little bit like static on a radio. You know, when you're far from the radio station, the signal tends to be weaker, and you kind of hear some distortion or some hissing or some inadvertent sounds. And so when it comes to tinnitus, you know, there may be a variety of causes. There may be damage to the auditory nerve. There may be, you know, changes in the brain. People experience tinnitus after exposure to too much noise, and you don't have to be a rock star or a heavy metal music fanatic to experience damage to your ear resulting in tinnitus. But it's also possible just by living in an urban environment. We're exposed to too much in the way of sustained loud noises. And so since it's in the brain, the suggestion is that we want to target the brain and not so much the ear. There's a popular supplement called lipoflavonoids that are thought to be helpful, but I haven't found them that effective in dealing with tinnitus. They're touted for treatment of tinnitus. And I guess, you know, whenever you use anything for tinnitus, there's some placebo effect and it gets a little better. I also think there's some support for the use of ginkgo biloba, which is a circulatory enhancer, which may be helpful. There's masking technology, you know, just like you can use noise-canceling headphones when you're on a plane to take out some of the ambient noise, or, you know, when you're on the street. You can use newer forms of noise canceling, like just basic external noise is easier to cancel than internal noise, but they're working on ways of detecting the frequencies that will help people who experience tinnitus have less of a subjective experience of noise. There's also, I think, in the future, they may be doing some forms of brain zapping treatments that actually hit the part of the brain that's responsible for extraneous sound and noise. And I think they're just pioneering these techniques, but just as we're doing various ways of treating atrial fibrillation with ablation, they may be using some form of brain-directed ablation to break up the aberrant nerve pathways that cause people to hear whooshing and ringing sounds. That's something that may be coming down the pike. I've had some success also in treating patients with high-dose NAD supplements, in particular nicotinamide riboside. And I think there's some research on these types of products. I mean, just good old-fashioned niacin or B3, some people claim relief. There's a high degree of placebo response to this, and that suggests a role for what's called CBT, cognitive behavioral therapy for tinnitus. And that helps people cope with their tinnitus. It doesn't make it go away, but since it's a subjective experience, people can kind of contextualize it and put it in the background and not be so haunted by it. It tends to be associated with depression because it is depressing. And by talking people through it and providing people with kind of a new context to put it in its rightful place, CBT for tinnitus sometimes helps tinnitus sufferers. But for now, there is no cure. I'm pretty sure that they're working on all cylinders trying to find a proper fix for this common disorder. But I can't say that there is something that consistently works. And if any of you are out there and you've learned of anything that works for your tinnitus, or you want to share your success story with us, please do so. 877-726-8255 is our number. And this item, and this is something near and dear to my heart because having gone to medical school, I suffered from a lack of nutrition instruction. And I was interested in nutrition during medical school, so I had to go hither and thither and yon to gather my nutrition information. It wasn't all available at my medical school, so I went to other medical schools. I did independent study, and I managed to put together my own custom portfolio, attending conferences and so on, to learn more about nutrition. This item is from the New York Times, How Kennedy is Trying to Revamp Medical School. And there is an update on his efforts and conflicting information about it. Because on the one hand, RFK Jr. professes optimism on whether he will be able to change the current abysmal situation at medical schools. Very few offer extensive nutrition training for future doctors. And as far back as 1962, this Times article says, the American Medical Association held a conference on the matter after a report by the group concluded that there was, quote, inadequate recognition, support, and attention given to the subject in medical schools. That's 1962, so that is what? We're talking 60 plus years ago. But according to Marion Nessel, who's been a guest on Intelligent Medicine, she's an emeritus professor of nutrition at NYU, nothing much has budged since then, 60 plus years. She says medical schools do offer some instruction on the subject, but a survey published in 2015 estimated that only 29% of institutions had provided at least 25 hours on the subject over 4 years of medical school. That's a lot, because I think I got maybe 4 or 6 hours. What RFK Jr. is doing is he's jawboning with these medical schools to make them incorporate more nutrition. And he acknowledged the wariness of some medical schools that, quote, some of them didn't want it because they said it's a Trump program. They're at odds with the Trump administration or a variety of things. And unfortunately, nutrition, which should be a bipartisan issue, has been tainted by association with the MAGA movement. And MAGA movement, okay, like it or not, under Trump's stewardship, we've got RFK Jr. pushing MAHA, and I would think that this should be something that all medical schools would embrace, but not such luck. Part of the problem is that when you graduate from medical school, it's like drinking from a fire hose. You have to have all this information at your fingertips, and then you have to pass exams. And on the exams, there are virtually no questions about nutrition. So they say, well, why should we teach nutrition when if we teach nutrition, we won't teach people the requisite skills to pass the exams? And so now a spokesman for the Federation of State Medical Boards, one of the sponsors of the medical licensure exam, said in an email that program officials were, quote, actively planning further nutrition-related enhancements to the exam. In other words, because if there are no exam questions about nutrition in order to get your certification to become a doctor, why teach it? Why teach it, right? So, I mean, even though it's a good thing, but you got past these exams. So, I just think some of the medical schools are saying, oh yeah, we've heard this before. It's been 60 plus years. We've been hearing the same tune. If we can just wait out this administration and it'll soon be over, we can just go back to teaching our students about the fundamentals of how to treat diseases with drugs and surgery and emerging breakthrough technologies. That's, I think, where they think their bread and butter is, unfortunately. Here's an item, though, that is encouraging, is that there is what is called a Culinary Health and Medicine program that is made available by the NOVA Institute, collaborating with the University of Maryland Center for Integrative Medicine. They say that our program focuses on experiential nutrition education. Doctors actually, prepare their own foods and eat them. Education through practical instruction in healthy cooking. So they have teaching kitchens and multidisciplinary teams of medical educators, physicians, dietitians, researchers, and community health advocates to educate future physicians and to get them to experience healthy nutrition, to better equip them to help patients with practical tools for preventing and treating disease. So, we need more of this, but, I'm only cautiously optimistic about whether medical schools are going to have buy-in on these initiatives. It may be tough to make the case, unfortunately, for many medical schools. 877-726-8255, our number, and this is Intelligent Medicine. Our brains are made mostly of fat, so why not nourish them with the highest quality omega-3s available? Omega-3 Rejuvenate from Big Bolt Health. Omega-3 Rejuvenate is a premium blend of pure oils from wild-caught Alaskan cod and sockeye salmon, sourced from the pristine waters of Alaska. This is not the story of other brands. The fact is, most of the world's fish oil products are produced from several types of species packed into nets in commercial fishing zones, loaded into the holds of vessels that stay out for days or even weeks, and put in processing plants that treat them with high heat, chemicals, and synthetic nutrients. Big Bold Health does it differently. All of it straight from the sea into the hands of skilled fishermen, instantly flash frozen and taken to their specially designed shoreside plant using a low-heat technique to extract the pure amber omega oil that contains all natural and abundant full-spectrum omega-3s, including EPA, DHA, as well as DPA, plus all natural vitamins A and D, and naturally occurring pro-resolving mediators to support cardiovascular, cognitive, and immune health. Their unique low-temperature extraction preserves the natural goodness of the fish so you get maximum benefits in every soft gel. No fillers, no shortcuts, just pure, potent wellness. Visit bigboldhealth.com/Hoffman and experience the difference. That's bigboldhealth.com/Hoffman for Omega-3 Rejuvenate. Use coupon code Hoffman20 for 20% off site-wide. If your quest for longevity feels overwhelming, here's some good news. It starts with one simple daily habit. MitoPure gummies from Timeline. They're the first ever longevity gummies that ignite mitophagy, your body's natural anti-aging pathway. MitoPure is a clinically validated solution backed by over 15 years of research. MitoPure gummies utilize a powerful compound that redefines what's possible for your longevity. MitoPure produces the first ever urolithin A gummies
that supports your cellular energy so you feel strong, clear, and vibrant. Boost your cellular energy and enhance muscle strength and endurance, all without changing your diet or exercise routine. As someone who loves to stay active, I've noticed a significant boost in my workouts since I started using it. I feel stronger and more energized, and my recovery time has improved dramatically. Better recovery starts at the cellular level. For more information and to order, just go to timeline.com/Hoffman. Use coupon code Hoffman at checkout for 20% off. That's timeline.com/Hoffman for 20% off MitoPure gummies with code Hoffman.
drhoffman.com, your portal for cutting-edge information on health and nutrition.
Welcome back to Intelligent Medicine. Dr. Ronald Hoffman here. There's an interesting article in Scientific American. Can sunlight cure disease? And I think it was John Denver who wrote the lyric, sunlight on my shoulder makes me happy. And I just rewatched the movie Midnight Cowboy, and the song kept playing, I'm going where the sun keeps shining through the pouring rain. And there definitely is a curative effect of sunlight. This is recognized literally centuries ago when sick patients were wheeled outside of their hospital rooms and placed on the balcony or on the patio or in an outside space in order to get healing rays. Unfortunately, they don't do that very much anymore, but it resulted in many remarkable turnarounds. And sunlight is a mixture of spectra of light. If you study this physics in high school, you know that there's the visible spectrum, which is like the rainbow colors, and then below red is near-red, infrared, which has healing capabilities on its own. There's actually studies that show that near-red light can activate the mitochondria, improve energy. And on the other end of the spectrum, there's ultraviolet light. UV light is what you get in tanning booths and what you get from the sun and what they think is really bad. UV light is bad for you. But there's evidence from epidemiology looking at rates of autoimmune diseases across different latitudes. And what they have found is that at very high latitudes or very low latitudes, if you're in the southern hemisphere, there's a higher rate of multiple sclerosis. And so they began, and also higher rates of colon cancer and higher rates of autoimmune diseases like ulcerative colitis and Crohn's disease. And they thought it was about vitamin D. In one autoimmune disease, ultraviolet light is approved. Psoriasis. You can get psoriasis, ultraviolet light boxes for home treatment of psoriasis. It's paid for by medical insurance and Medicare. So it does work. But it turns out it's not just about vitamin D, because studies where they give high doses of vitamin D to people with autoimmune disease, it helps, but doesn't help as much as getting sunlight or ultraviolet light. So this article from from the Scientific American, can sunlight cure disease? Sunshine may hold healing rays for a variety of autoimmune diseases such as multiple sclerosis. Scientists are turning this surprising discovery into treatments. And what they've actually done some studies. They did a mouse study that showed that ultraviolet treatment protected mice against multiple sclerosis, but without increasing their vitamin D levels. So it wasn't about that we know you get in the sunlight, you make some vitamin D. That's why people, when they go outside, they say, well, I'm getting my vitamin D. In addition to vitamin D, the skin produces other beneficial compounds like melatonin, serotonin, endorphins, endocannabinoids, cortisol, oxytocin, leptin, nitric oxide, and dozens of other compounds that we don't even have a name for. So they're beginning to explore, and it's one of those things where, it is potentially toxic to go into a tanning booth and blast your skin and increase your risk for skin cancer. But at the same time, there may be therapeutic effects of moderate sunlight exposure or ultraviolet exposure, especially for autoimmune diseases and potentially for cancer. 877-726-8255, our number, and this is Intelligent Medicine.
Have you ever heard someone say that probiotics didn't work for them? Since all probiotics are not the same, the probiotic you choose can make the difference between superior results and no results. Look for an enriched formula containing these 3 key components for best results: probiotics, prebiotics, and postbiotics. A worldwide leader in microbiome health for over 40 years, Dr. Ohhira's Probiotics is an enriched full-spectrum probiotic system fermenting multiple strains of probiotic bacteria and nourishing prebiotics. The result? Transformative postbiotic metabolites that maintain and support the biodiversity of flora in your gut for optimal digestion, gut-brain, and immune health. Dr. Ohhira's, certified vegetarian, free of gluten, allergens, dairy, and GMOs. Get Dr. Ohhira's probiotics today at Sprouts, Natural Grocers, Whole Foods, and other natural health retailers nationwide.
Kids don't just bring home homework, they bring home germs. And those germs don't just stay with them, they spread to the whole household. That's why Clear Nasal Spray was created by a practicing physician to give parents and grandparents peace of mind. You may not think about it, but your nose is filtering out a semi-truck full of air every single day. Clear isn't just another spray. It creates an additional layer of protection in your nose that blocks bacteria and viruses before they can even take hold. Yes, even that virus. Supporting your body's defenses right where germs first try to enter. Clear is a hygiene product recommended for daily use, drug-free, non-drowsy, and safe for all ages. Just a quick spray in the morning and evening helps you cleanse your nose. Don't just hope for protection, create it. Get Clear Nasal Spray, your daily defense. Clear Nasal Spray is available at retailers nationwide and online. Check out Xlear.com for our special offers. That's Xlear.com.
A regular dose of intelligent medicine injected directly into your inbox. Subscribe to Dr. Hoffman's free newsletter. Just go to drhoffman.com.
Welcome back to Intelligent Medicine. Dr. Ronald Hoffman here. Our number is 877-726-8255. And that's the portal to intelligent medicine. That's how you get directly into the doctor's office. You call 877-726-8255. You can record a question or share a comment. Let's hear that one.
Hi, Dr. Hoffman. I have scheduled dental x-rays, and on the same day, I have an MRI of the head. Maybe like 2 hours apart. So I have dental x-rays and an MRI of the head scheduled on the same day. Just wanted to know your opinion, if there's any dangers in doing that. I would appreciate your opinion. Thanks again.
Okay, so that's a very interesting question. I don't think I've ever heard this question posed in this particular way. You know, we talked about the hazards of dental x-rays. We've even talked about some of the hazards associated with gadolinium, which is sometimes injected for contrast MRIs. But I've never heard about the juxtaposition of dental x-rays and MRIs on the same day. So I would say up front that, that could be a little bit of a hectic day. But aside from that, let's look at the actual physics involved. With dental x-rays, you're going to get a small amount of ionizing radiation. And it's the same kind that you would get with a chest x-ray or with a CAT scan or with a CT PET scan. And we know that x-rays, cumulative x-rays, can add to one's risk of lifetime cancer. Okay, but by a small percentage point. You'd have to have a lot of x-rays, year in, year out, to acquire a slightly increased risk of cancer. But this kind of argues for judicious use of x-rays and also judicious use of dental x-rays. I don't do a dental x-ray every time I go to the dentist, although they want me to. To some extent, it helps them diagnose things that might be brewing. I understand that, but to some extent, frankly, it's a bit of a moneymaker because they can bill for the x-rays, and I sign a thing often if I don't have a dental problem and I just want a cleaning and an exam, that I don't want my, quote, routine annual dental x-rays. Because cumulatively, maybe not one single x-ray. I mean, if a guy has tooth pain, yeah, please do an x-ray. Maybe don't do a whole, panoramic film of my mouth. Just look at the area involved. So what about when you combine that with an MRI? Well, MRIs are magnetic resonance imaging, and they don't involve ionizing radiation. So it'd be one thing if you said, I'm having dental x-rays and a CT scan on the same day. I'd say, well, maybe, there's a cumulative effect of, x-rays directed at your mouth and x-rays directed at your head. We used to do more CT scans of the head. Now we prefer the MRIs of the head. I would say that there's no additive risk, except for the fact that could be a tiring day. And, I'm not suggesting that you take high doses of antioxidants or anything like that. I mean, you can take a little bit of that kind of stuff if you want some protection from the dental x-rays, maybe some higher doses of your usual antioxidants, maybe coupled with some N-acetylcysteine, which is a potent antioxidant. But, since the x-rays used for the mouth are relatively low intensity, much less than you get from a CT scan, it's no biggie. So I would say, go ahead and do it. And address all your problems in one day. 877-726-8255. Folks, as you know, it's important to me that the supplements I recommend and use are of the highest quality. That's why I stock the Protocol for Life Balance product line at my online dispensary, drhoffman.com/Protocol for Life Balance. Protocol for Life Balance offers a wide range of professional-grade products using ingredients backed by strong scientific research, including a great suite of supplements specifically designed to support neurological health and cognition. And we discussed them in a recent podcast, great podcast with Neil Levin, who is Senior Communications Manager for Protocol for Life Balance. The products include a bioavailable form of curcumin. It's called Cogumin SLCP. Cogumin SLCP is curcumin optimized to penetrate the blood-brain barrier, where it helps protect the brain tissue. There's also a form of brain-optimized magnesium, which is called Magtine. Magtine may support healthy cognitive function. It's magnesium threonate. And then there's good old-fashioned phosphatidylserine, abbreviated PS. PS I forgot. Well, it is good for memory. It supports neuronal membrane fluidity, promoting cognitive function and mental acuity. And then there's a combo product of a variety of herbs that support brain health. It's called Brain Regain, and that may be advantageous for supporting healthy cognitive performance. So for more information to order, just go to drhoffman.com/Protocol for Life Balance. That's drhoffman.com/Protocol for Life Balance. Protocol for Life Balance is an A-rated GMP manufacturer of premium dietary supplements, and one of my favorite brands. And listen to that recent podcast with Neil Levin, too. And we also have a nice article about brain supportive nutrients, courtesy of Protocol for Life Balance at drhoffman.com. So use all the resources available to support your brain health. This side of, and early on, I was an early adopter of gut health tests. They're based on stool, and I started testing stool in the 1980s. So I think I was kind of a pioneer in that regard. And companies built enormous customer followings and fortunes on stool testing, where we looked at the health of the microbiome. This was recognition that what happens in the gut really matters for the rest of the body, and that people had imbalanced bacteria, perhaps overgrowth of yeast or potentially parasites. This could have systemic ramifications that could be the root cause of a variety of health problems. So stool testing has become something very fundamental to what is called functional medicine. It's like looking at health in a holistic way, looking at root causes, looking at all aspects of a person's lifestyle and environment to determine how to prevent and treat disease. So what is concerning is that these tests that we rely so much upon to predict disease or to tell us whether people have a healthy gut or whether they have an unhealthy gut, also known as dysbiosis, may not be reliable, according to a recent survey. So what they did was they looked at 7 direct-to-consumer microbiome testing companies. And by the way, these I've only used the ones that are used by medical professionals. But more and more what are appearing are direct-to-consumer microbiome testing companies that purport to give you the read on your microbiome health, sometimes accompanied by advice to buy certain supplements. Yeah, they kind of cash in on their own recommendations. That's a little bit of a conflict of interest, in my opinion. But they sometimes use the stool test as a lead-in to a product pitch. So they sent 3 identical fecal samples to 7 direct-to-consumer microbiome testing companies under different names, different false names. And they wanted to find out if they reported consistently. And what they found was that there were discrepancies among companies that claimed to give consumers insight about their gut health. And so, for example, the stool samples were identical. They actually mixed stool samples from a variety of donors, and they put it in a blender, and then they sent out identical stool samples under 3 different names to 7 different companies. And what they found, that some companies were consistent with the microbes they identified across the 3 samples. So that's the good news. But one company produced a drastically different result on one of the 3 samples it tested. It classified the 2 similar results as healthy and the outlier as unhealthy. Others identified many of the same types of bacteria across the identical samples, but showed varying amounts of those bacteria. And so, in fact, it was so bad that the discrepancies between the company's results on the identical standard sample were similar to variability among samples that came from different people. So I got to say that this is a important technology, and just like blood tests and just like medical imaging, is that stool tests can yield really important insights on our health, but it is so complicated that we're just in the dawning era of our understanding of how to A, properly test, and B, properly assess the results of our tests. And the final step, C, is to implement the findings for a therapeutic approach that can correct the underlying imbalance and move things in the right direction. So, so one company had big inconsistencies in the types of microbes that are detected, and not good news for these direct-to-consumer tests. 877-726-8255, our number. This is Intelligent Medicine.
There were many important reasons why I started my FullScript online supplement dispensary. I wanted to offer you the same curated professional-grade supplement brands that I use, the ones I know and trust. I also wanted to ensure that they weren't counterfeit or expired. Recently, I've been hearing more and more about counterfeit or expired products purchased from online retailers. With FullScript, you can be confident your supplements are genuine and they'll arrive with optimal freshness and potency. Also, buying through FullScript offers fast, free shipping, optional refill reminders, and a highly rated mobile app. It's safe, secure, HIPAA compliant, and offers world-class support. Go to drhoffmanstore.com for more information and to start your free FullScript account. You'll get access to the supplements and features you need to help you achieve your wellness goals, including my custom targeted protocols that combine the products I recommend to address specific needs: heart health, immune support, and much more. To get started, just go to drhoffmanstore.com, drhoffmanstore.com. As you know, it's important to me that the supplements I recommend and use are of the highest quality. That's why I stock the Protocol for Life Balance product line at my online dispensary, drhoffman.com/Protocol for Life Balance. Protocol for Life Balance offers a wide range of professional-grade products using ingredients backed by strong scientific research, including a suite of supplements specifically designed to support neurological health and cognition: Coggumin SLCP, Magtine, phosphatidylserine, and Brain Regain. Cogumin SLPC is curcumin optimized to penetrate the blood-brain barrier where it helps protect brain tissue. Magtine may support healthy cognitive function, learning, and memory. Phosphatidylserine supports neuronal membrane fluidity, promoting cognitive function and mental acuity. And Brain Regain is a broadly useful herbal health aid that may be advantageous for supporting healthy cognitive performance. For more information and to order, just go to drhoffman.com/protocol for life balance. That's drhoffman.com/protocol for life balance. Protocol for Life Balance is an A-rated GMP manufacturer of premium dietary supplements.
Subscribe to the Intelligent Medicine Podcast, updated several times weekly. Go to drhoffman.com.
Welcome back to Intelligent Medicine. Dr. Ronald Hoffman here. Our number is 877-726-8255. And that number is a number that you can call to reach us as Intelligent Medicine with a comment or a question. We'd be happy to hear from you next week. Question is, why do most men get prostate cancer if they live long enough? It is said that if you do an autopsy on a man who dies of old age at, say, 89 or 92, and you slice and dice their prostate, it is very likely that you will find a small early prostate cancer, even if they didn't suffer from identified prostate cancer during their lifetime. Is that prostate cancer is virtually ubiquitous as a consequence of aging. And perhaps, and this has been said, is that we simply live longer. We weren't really designed to live past reproductive age, and that through modern hygiene, modern lifestyle, and modern medical interventions, we're simply living longer, so our body has more chance to develop mutations that occur particularly in places like the breast and the prostate, and that therefore we're seeing more of these changes. But is it really true that if a man lives long enough, that it's inevitable that they'll get prostate cancer? Even those are the prostate cancers that may not kill you if they're identified at the age of 85, because it may be that prostate cancer that would kill you if you live to 140, which you won't. So, I just threw out my plastic cutting boards. I just really was concerned about microplastics that were being released. With every time you slice and dice something on a plastic cutting board, inevitably you're releasing tiny particles. You can't even see them that enter your food, and then they enter your body, and they find their way to your brain. They find your way to atherosclerotic lesions. They found a high level of microplastic particles in atherosclerotic lesions. And guess what? Now they found microplastics in 90% of prostate cancer tumors. Researchers examined prostate tissue collected from 10 patients undergoing surgery to remove their prostate. Plastic particles were identified in 90% of tumor samples, but also in 70% of benign prostate tissue samples. So, sometimes you get your prostate shaved down or removed. If you simply have an enlarged prostate, there's no cancer. So, but the higher the count of plastic particles, the more likely it was that the biopsied tissue was likely to be cancerous. So they found that in cancerous tissue, there were 40 micrograms of plastic per gram of tissue. But in non-cancerous tissues, there was only 16 micrograms per gram. So it was like a almost threefold increase in plastic in the cancerous tissue than in the benign tissue. So they don't know why this might be something that prompts cancer. It's an associative study. It doesn't necessarily mean that the microplastic caused the cancer, but they say it is mechanistically plausible that microplastics can enhance inflammation within the prostate, which is a precursor to cancerous transformation. And so this is a concern, and ultimately we need to reduce our dependency on plastic, drink less from plastic bottles. That's a major source, but also just pollute our environment less with plastics, reduce the amount of plastics that we're releasing by hundreds and hundreds and hundreds and millions of tons every year into our air, ground, ocean, and fresh water sources. And food sources, unfortunately, fields and plants incorporate microplastics as well as do agricultural animals, and we're consuming more and more microplastics than ever in human history. That indeed is a concern. This item, I hate to, this is a kind of a downer segment, but I got to share this information with you because PFAS chemicals, we've talked about these forever chemicals which lurk in everyday products. And the problem is that PFAS chemicals are harmful. It's been acknowledged. But lately, we've slowed down regulation on PFAS chemicals. And recently, the Trump administration has relaxed regulations on companies that use PFAS chemicals. The EPA has relaxed several PFAS regulations. They're reducing enforcement of their drinking water standards. They've rescinded regulations on PFAS compounds like PFHXS, PFNA, PFBS, and something ingeniously named Gen X. Okay. So I would think that Generation X would have taken out a copyright, but a PFAS compound is now named Gen X. All right. They've also proposed significant changes to the Toxic Substances Control Act, aimed to reduce the compliance burden on industry by exempting reporting on byproducts, impurities, and non-isolated intermediates. So they're relaxing the strictures on PFAS compounds. But new finding. PFAS found in most Americans linked to rapid biological aging. And the way that they've determined this is through research that looks at the aging clock. And they found that there was a correlation between high levels of PFAS compounds and acceleration of the aging clock. In other words, chronologically, you may be 65, but according to your aging clock, you may be younger, you may be 55, or you may be 85. And this can be determined through what is called epigenetic testing using methylation clocks and other devices. And what they found is accelerated aging due to PFAS exposure. Well, thanks for joining us, and hope you found it informative. 877-726-8255, our number, drhoffman.com, the source for information about intelligent medicine. Check us out, subscribe to our newsletter, follow us on social media, and have yourself a healthy weekend. I'm Dr. Ronald Hoffman.
There were many important reasons why I started my FullScript online supplement dispensary. I wanted to offer you the same curated professional-grade supplement brands that I use, the ones I know and trust. I also wanted to ensure that they weren't counterfeit or expired. Recently, I've been hearing more and more about counterfeit or expired products purchased from online retailers. With FullScript, you can be confident your supplements are genuine and they'll arrive with optimal freshness and potency. Also, buying through FullScript offers fast, free shipping, optional refill reminders, and a highly rated mobile app. It's safe, secure, HIPAA compliant, and offers world-class support. Go to drhoffmanstore.com for more information and to start your free FullScript account. You'll get access to the supplements and features you need to help you achieve your wellness goals, including my custom targeted protocols that combine the products I recommend to address specific needs: heart health, immune support, and much more. To get started, just go to drhoffmanstore.com, drhoffmanstore.com.